Good afternoon. The COVID-19 pandemic has resulted in unprecedented disruption to the lives of children and family across the country and across the world. Today, I'll be presenting some very preliminary data from studies designed to understand the impact of the pandemic on children and families. So why study the impact of the pandemic on families? I'll start by sharing with you some of the least surprising data you'll probably see all day. Here are some preliminary descriptive data from a large international collaborative study that showed that across 20 sites from 12 different countries, worries about family members getting COVID-19 are at the very top of the list. Results from other studies I'll share today indicate that there's likely some good reason to be worried, particularly for individuals from families who are already at risk. This is apparent in some recent work our collaborators and us have been doing, looking at the impact of the pandemic on pregnant mothers living in poverty. So in this ongoing study, we're examining the impacts of prenatal stress on infants' brain development. And when we look at differences in birth weight between mothers in their third trimester, who were in their third trimesters before the pandemic, and compare to mothers who were in their third trimester after the pandemic, we see no difference in birth weight for mothers living above the poverty line, the federal poverty line. But we see an over 1 pound decrease in birth weight for infants of mothers who are living in poverty. These are very preliminary data that could be consequence of any number of things, but we do also have some preliminary evidence suggesting these mothers are also experiencing stress. So cortisol is deposited in the hair as it grows and provides insight into experiences of chronic stress. Examination of hair cortisol deposits in the same sample show a substantial jump in the amount of cortisol present pre-lockdown as compared to post-lockdown. This has enduring consequences for the physical and mental health of these mothers, as well as immediate consequences for these parents, given research showing that early stress may undermine the early mother-infant relationship. And it's not just new parents who have shouldered the stress of the pandemic. In an attempt to understand the impact of the pandemic for parents of older children, we used a data-driven approach to identify two groups of parents. You'll see we identify a group which has been highly impacted by the pandemic, as evidenced by elevated levels of depression and anxiety, slightly increased worries about the pandemic, and elevated parental burnout. Parents in this highly impacted group are also more likely to live in poverty. And across the first 9 months of the pandemic, parents in this group reported increases in their own intrusive and over-controlling parenting behaviors, increases in their children's aggression and other related problems, and decreases in their children's prosociality. And the impact of the pandemic on children's social and emotional functioning extends beyond parents' observations of their behaviors. Children's opportunities for social interactions have been severely limited, and to understand potential consequences of children's new social worlds, we altered an emotion recognition task we use in my lab to test the effect of masking. Unsurprisingly, accuracy of emotion recognition was negatively impacted by the presence of masks, and the effect of masking was related to worse emotion recognition when families reported increased social distancing. However, it's not all bad news. We have also seen many examples of resiliency among these children and families. For example, we didn't find any changes in overall emotion recognition from pre-pandemic to post-pandemic, and recently published research suggests that mask wearing does not meaningfully impede mothers' interactions with infants. And in our own data, we find children were still able to meaningfully connect with others. So nearly 60% of the families in this study reported being able to create opportunities for their children to engage with peers and family members virtually. And we see that children's ability to virtually connect with peers positively related to their own emotional perspective taking across the pandemic. A theme from this work and from developmental science work in general are that families naturally reorganize and adapt. Although the pandemic continues to have far-reaching consequences for children and families, it's offered an opportunity to better understand resilience as well.